everyone. Welcome. I am Lisa.
And I'm Steph.
And together we are
PD Connect. It's our 10-year anniversary.
Yes.
That's why she's pointing at that. Together
Welcome.
being PD Connect, we are a nonprofit in the San Francisco Bay Area, but virtually
wherever you are.
And we teach exercise and education for people with Parkinson's, and you're at our speaker series. Thank you so much. Today, we have got a really great guest speaker, Dr. Christina Woo, and our topic is Parkinson's and oral health, personalized, practical, and preventative care. So let's go ahead and intro Dr. Christina. There's a lot to say about her, but I'll make it short. Are you okay with that?
Got it.
I also have to start by saying I love teeth. I love flossing. I love water picking. I love brushing my teeth.
He does.
They even took my toothbrush away once because I brushed them too many times. Anyway, the point is,
how many cavities have you had?
Don't knock on wood. Okay. All right, let's get back to it.
Okay.
Dr. Christina Woo, welcome. Thank you for being here. She is a general dentist based in San Francisco. She earned her doctorate in dental surgery from the UCLA School of Dentistry and completed a general practice residency at the University of Pacific Highland Hospital, where she developed a strong foundation in caring for medically complex, elderly, and special needs patients. That's pretty cool.
It's very cool.
In her clinical practice, Dr. Woo provides thoughtful, patient-centered care with an emphasis on comfort, efficiency, and clear communication. We love that, don't we?
We do.
She has experienced treating individuals with various medical conditions, including Parkinson's disease.
That's why we're here.
And understands the unique challenges that can accompany dental care for both patients and their caregivers. She's known for her calm, detail-oriented approach, also dental-oriented approach. Dr. Woo strives to make every dental visit as smooth and enjoyable as possible. Outside of the clinic, she enjoys hiking around the Bay Area, exploring new bakeries, and spending time with her family and friends. Thank you so much for being here.
Thank you so much. Yeah, you know, out of the blue today or the other day, I got an email saying Dr. Woo is their doctor, and she is awesome.
We love that.
Was what the email said. So thank you so much for being here.
Yes.
Go ahead, Dr. Woo, and feel free to share your screen.
Okay. Can you see my screen?
Yeah.
Yes, we can. Perfect.
All right. Thank you for the introduction there. I'm Christina Woo. I am a general dentist based in San Francisco, and I work closely with patients who have special needs, including those with PD, both in private practice and in hospital settings. I know how hard it can be to keep up with dental care, especially when your loved one is constantly moving, has trouble opening wide, or struggles with dry mouth from medications. So today I hope to share with you some practical ways to make daily care more manageable and help you know when it's time to reach out to a professional so you are not alone. Here we go. Okay. So I'm going to begin with Parkinson's disease and how it creates unique oral health risks. And then we'll go over some modifications to dental care so that we can enhance the quality of life for PD patients. Okay, so what kind of special oral health risks are common in this community of PD patients? Today, I'm going to focus mostly on motor and postural challenges, and also how medications affect dental care in PD patients. So here are two common oral motor challenges in Parkinson's. First, we have a limited mouth opening. So this is often less than 35 millimeters, which makes it very hard to clean or treat the back teeth. To help, we use modifications. Here in the office, we use this a lot. It's a soft foam bite lock that has a long handle and it keeps the mouth safely open. So it also is safe to chew on and allows a caregiver to brush with the other hand. These are also very easily purchased online and are available to all. Another challenge listed here are jaw tremors in PD. So these are, of course, involuntary rhythmic motions that will make it hard to keep the mouth open and also can cause fatigue. So solutions can be as simple as taking frequent breaks and doing shorter dental appointments. And for those who have more severe disease, we may consider other options like sedation, including general anesthesia and oral medications like Ativan and nitrous oxide if appropriate, which is laughing gas. It can also cause difficulty with dental appliances, so jaw tremors can sometimes cause a risk for choking on night guards. So we will have to go into that more later. Okay, so another challenge that I've seen in this community is reduced tongue range or strength. So this, the tongue is basically our mouth's built-in toothbrush. So if it can't move properly, then the food and plaque stick around the teeth for longer. So just add dry mouth or denture use, and you can see how this is a perfect environment for fungal infections like oral thrush, which is seen on the right side. And that's the white coating there on the tongue. So reduced tongue strength and poor swallowing are common in Parkinson's, and they make it hard to clear food and saliva. So we recommend generally a very consistent oral hygiene routine. And even a few seconds of brushing with toothpaste, I would say, is better than nothing. So consistency, I would say, matters more than perfection. Okay, so this is for swallowing, so slide dedicated to that. And that's a very common challenge faced by PD patients. So this not only affects just the throat, but the entire mouth. So when swallowing is impaired, fluid and saliva linger in the mouth longer than they should. And this, of course, leads to cavities, gum disease, and bad breath. A greater issue is the risk of infection. So because the bacteria aren't cleared, they can be inhaled into the lungs, contributing to what we know as aspiration pneumonia. So that is a very serious infection that we want to try to avoid by keeping the mouth clean. So for patients with poor swallowing, I have this tool that we use here in the office is actually a home suction unit. Well, we use it when we go outside the office because it's portable. And this is just one brand, but there are other brands as well. And generally all these parts are single use. So a home suction unit can have these attachable toothbrush and also tongue swab that can help safely remove buildup and secretion. So I actually have this link on the bottom that demonstrates how to use these attachments. If we have time, then I can send that to you later. So move on here. So the next slide is about jaw clenching and teeth grinding. So those are both common in PD due to muscle overactivity or stress. This causes teeth wear, fractures of teeth, jaw pain, and even failure of dental work. So the image shows how grinding wears down the teeth over time. You can see that the teeth are very short, and the healthy enamel is also being lost. So if the grinding is causing pain or fracture of teeth or inability to eat, then something like a night guard may be cautiously considered. So in terms of this particular population, a night guard is probably not suitable if there is constant jaw movement, moderate to severe tremors. If the night guard is loose at all or dislodges, then it's not retentive enough. So if also the patient has a history of choking or coughing during meals, or a history of aspiration pneumonia already, then a night guard is not a good appliance to use. And then it's also important to have someone like a caregiver supporting the use of this appliance. So cognitive impairment also affects if we would recommend to use a night guard. So actually, sometimes tooth grinding may actually look like what we call abnormal movement. So dyskinesia, which is an involuntary movement we see a lot in Parkinson's, especially during what we call the on periods or when the dopamine levels peak. So these dyskinesias can mimic bruxism, but sometimes they don't involve strong tooth contact. So in these cases, it might be a medication adjustment instead of a recommendation for a night guard. And that's something that would be consulted with by the patient's doctor, medical doctor. Okay, so here we have a slide talking about neck and jaw dystonia. So many people with Parkinson's will develop postural changes. And this also affects how we provide dental care. So again, both of these are related to dopamine levels being either too low or too high. So the neck dystonia is, as you can see from the photo, it's when the head is tilted to the side, and that can make it hard to access the mouth for someone in the dental chair. And also for self-care at home. And then there's jaw dystonia, and this is one photo that shows the jaw shifted to the side. It could also be held open or closed involuntarily. So when the neck or jaw is in this abnormal position, it can throw off the way that the teeth come together. So it makes the bite less predictable, and as the bite can shift a lot. So one option that is helpful for some cases would be Botox. So Botox can be very helpful because it blocks the message from the nerve to the muscle. So it's not for everyone. If swallowing is already affected, it can make that swallowing worse. And so we would need a consult with the neurologist or medical doctor. From my research, it seems that it is more effective, the Botox, if the movement is more localized or muscle specific and more predictable. And this usually is the case in earlier to mid-stage PD. So another effect that we see in this community is medication side effects. So there's a few I have listed here. So many Parkinson's medications have side effects that directly impact oral health. First off, and is very big problem, is dry mouth. And this is caused by a lot of medications, specifically the ones listed here, anticholinergics, dopaminergic agents, antidepressants, and even high blood pressure medications. So without enough saliva, the mouth becomes more prone to cavities, infections, and discomfort. And then I also have listed as a medication side effect, the rise and fall of medication levels throughout the day can cause motor fluctuation. So these tremors may worsen during dental visits if patients are in an off period, which can make treatment more difficult. Okay, so now I have some solutions here. Dry mouth for Parkinson's from Parkinson's medications will make teeth more prone to cavities. So hence, the home care is very important. So there are some over-the-counter strategies listed on this slide. One of them is baking soda toothpaste, and that is particularly helpful because it can neutralize the acids that cause cavities. And this is a Biotene mouthwash. It is a saliva substitute that coats the tissues. And then the third thing is looks like a xylitol mints that can help stimulate the saliva as well. Fluoride toothpaste like Preventive, we use that a lot in our office. It just has a higher concentration of fluoride than a normal toothpaste. MI paste is also another tool that we use. It has calcium phosphate, which helps restore minerals to the enamel. And then in certain cases, custom fluoride trays may provide some benefit. Of course, these should be used cautiously in patients with swallowing difficulties. So the other solution based off of our motor fluctuation due to medication timing would be to try to schedule dental visits during the patient's on time when the medication is at the peak effect. So generally, I believe this is about 60 to 90 minutes after medications are taken. So we want to ask, when do they move the best after the medications, and plan the dental treatment around that window so we can maximize comfort and cooperation. So what is dental decay? So it happens when bacteria in the mouth feed on the sugars and starches left behind from the food that you're eating. So that bacteria, it produces acid when it eats that leftover hamburger or fries, and that acid will cause the cavity. It breaks down the tooth structure. So it happens more often with starchy or sugary foods, which can stick to the tooth more closely than, say, a vegetable like a carrot. But the acid is, very bad for the enamel, and that's why we recommend something like a fluoride toothpaste to help remineralize the enamel. So dry mouth will leave the mouth without enough saliva to wash away the food. Saliva also has neutralizing properties. It has bicarbonate, so that neutralizes the acid that's produced from the bacteria. And it has calcium, so it remineralizes the enamel. So saliva is very important. Okay, so this is a special kind of decay that we see in PD patients, and especially just the elderly population in general. So why is that? As the gums recede, often due to gum disease or aging, the softer part of the tooth will become exposed. So unlike the enamel, which is hard, root surfaces don't have that hard protective shell. So they're much more vulnerable to that acid. So in dry mouth, like with soft and sticky diets and difficulty brushing, all of that compounds very easily and causes rampant decay called usually root cavities. So here we show two different methods that we use that's very helpful for treating cavities in the elderly population, especially when longer treatment is hard. So these are easily applied. One of them is silver diamine fluoride. So that's applied on the top photo where there's, you can see the progression of the cavity that actually looks black on the right side after 7 days, and that's because that means that the silver diamond floyd is working, and it does stop and harden the tooth structure, but it also turns the cavity black. So that's what it looks like when the cavity is arrested. And then fluoride varnish, we've been using for a long time in the dental field. It releases fluoride over time, and that can also help with remineralization. Okay, so I'm going to go over now some preventive strategies that we can implement for better quality of life in this population. So caregivers, what should they look for, and how often? At least once a month, caregivers should do a quick mouth check. So what are you looking for? You can see from this photo, there's a lot of things going on, but you can see that actually most of the cavities are under the crowns. So that's what I mean by root caries. So the crowns are intact. They had actually probably good dental work prior to the dry mouth, but as time progressed, their gums receded, and you can see a lot of the cavities are on the root surfaces. So you need to look for those areas. Other things to be looking for are red gums, sores or ulcers. A lot of times there's fungal buildup under a denture, any kind of broken teeth. So you can see there's broken teeth there in that image in the front. And then this is really important because if we can stop this process before it starts, early detection can prevent bigger problems down the line. So when do you need to see a dentist or a professional? So this is kind of an add-on to the last slide, but just if you're noticing any problems with eating, chewing, or refusing to eat, that's a functional difficulty that needs to be addressed immediately. And any kind of swelling of the face is a very emergent, so it needs to be looked at as soon as possible. Persistent dry mouth, also if suddenly you notice your loved one isn't able to brush their teeth and there's any change from the normal, it's time to call the dentist. So like I said, routine checks can help catch early infections and then prevent serious issues like pneumonia. Hopefully, keeping a healthy oral environment will prevent that bacteria from going into the lungs. So what kind of tools do we recommend? We like to recommend electric toothbrushes. So there's two brands that we really like here. Oral-B is one, and then Sonicare is another really great dentist recommended brand. They have a 2-minute timer, so that really helps ensure that you're brushing for the right amount of time. And they're proven to remove a lot more plaque than manual brushes. So I highly recommend an electric toothbrush. These are alternatives that can be helpful it's hard to grasp a toothbrush. Sometimes if you're slipping or struggling to control it, sometimes it's the tool and not the technique. So a big handle or a simple button, or even those like swabs that I was showing that can help brush the tongue. It's really about finding what works for your hands or caregivers' hands, and about the stage of the disease as well. So what are the standards for dental care? I would say for PD patients, we'd like to see them for cleanings every 3 months, just because they have difficulty brushing and flossing on their own. A yearly exam should be done with x-rays and treatment as needed. And then also if treatment is more extensive, then we may require sedation for safety and comfort. Okay, so what are some flossing alternatives? Flossing can be really difficult. So if it seems impossible, try a different tool, like a Y-shaped flosser, which is pictured on the right side. It reduces the demand for that fine motor control that we would need for a string floss, and it allows your caregiver to help more easily. It's also easier to hold, and you have one hand free. So water picks, I would say they can be helpful if there's no difficulty with swallowing. It's more for a pre-rinse to get the big food debris out. But you have to be careful because they can trigger gagging as well. I use these every day. They're called interdental cleaners. There's two brands here, soft picks and Proxa brushes, just a different delivery system. So it's for larger spaces, so it's particularly helpful for gum recession. And it's basically a floss replacement. So it doesn't get as far under the gum as a floss, but like I said, whatever works the best for you is the best tool. So how do we brush? We ideally would like to rinse first to remove the big debris if possible. And then it should be 2 to 5 minutes. 2 is the minimum. So you want to angle the toothbrush at a 45-degree angle to the gum line. So all of those root cavities that you were seeing in the photos are because I don't think those patients were able to brush the gums very well. So you need to make sure that you're actually brushing the gum line and not just the teeth. So you want to angle the 45-degree angle towards the gum. So on the top, it should be angled up, and on the bottom, the toothbrush should be angled down. And you want to use soft circular motions and go tooth by tooth. Of course, replacing the toothbrush is essential for just getting an efficient brush, because otherwise the bristles will flay out. So that should be every 3 months. Mouth rinses. So mouth rinses are helpful. They decrease the bacteria in the mouth. They provide fluoride. And only if you can rinse and spit safely. If swallowing is a concern, then you may want to ask your dentist if it's something that you wanted to add to your regimen. And then biotin also comes as a mouthwash, so that can help as a salivary stimulant. And then these are the lollipops with the sponge on the end, and some of them come with some mouthwash already embedded on there. Okay, so what does our office do? We try to tailor dental care to you. So on this slide, we have a photo of us at a house call, and what we can do is we'll travel to you within a 50-mile radius of San Francisco. So what does this service include? We can do cleanings, we can do a full exam, and we can take x-rays using our mobile x-ray unit, and we can do most fillings and most extractions, and denture care as well. And let's see, what is the process of a house call visit? So we start with an oral examination. Here's one of our patients that we see regularly, and you can see that they're in the comfort of their own home and able to be seen on the bed, and we bring everything to you. So the x-rays are on the laptop there, and I think she's even watching like Pretty Woman, or she likes that movie a lot. So we take photographs and x-rays, and then we'll gather all that information, and then we'll go over all of that after we processed what your goals are, and we'll go back with the whole support team and caregivers, case managers, or physicians, and consider how to proceed. Okay, so that ends my presentation. I know I had some questions that were sent to me ahead of time, so I have those listed here, but I can also go over specific questions to start.
Yeah, there are a lot of questions in the chat, but let's go ahead and start with your questions. Thank you so much, Dr. Wu. That was incredible. I loved, so on point. You just cut to the chase, deal with the problem, address it. Thank you for those very, very practical and very common conditions. So yes, go ahead with the questions.
Are they going to be in the chat?
No, we can go ahead. Yeah, there are some in the chat already, but
We
if
can
you want
start
to
with
just start
these.
with these, yeah.
Okay, I'll start with these. Okay, so I think a lot of these questions were already answered in the PowerPoint, but I will go over them again just to re-emphasize. I don't think I touched on the vegan or Mediterranean diet. So Mediterranean diets are, I believe, probably the best out there, even for teeth, because they support whole foods. They're low in sugar. And then as far as a mineral and vitamin standpoint, they're also rich in calcium, vitamin D, B12, and omega-3s. And these are all enamel supporting and anti-inflammatory. So I would say that a Mediterranean diet is a good way to become healthier overall and also is good for your teeth. Vegan diets can be healthy because they reduce the amount of, I would say, they're great for dieting and losing weight generally, but they need to be supplemented because a lot of times they're lacking the same vitamins. So calcium, vitamin D, B12, those should be supplemented with a vegan diet. And we want to be careful with processed snacks or fruit because those are pretty sugary and will cause cavities, like those starchy foods I was talking about. So we want to minimize sugar, acids, and frequent snacking, and supplement a vegan diet with vitamins. Let's see, the second question is, in Parkinson's disease, how do too much saliva or too little saliva affect teeth, and what remedies are suggested? So we talked about drooling as a sign of swallowing difficulty. So that often leads, because the food can't be cleared, that leads to food buildup and higher cavity risk. And then dry mouth, so that's due to a variety of things, mostly medications, and also some mouth breathing, probably due to like the posture of being bent down. So that also will extremely increase the risk for cavities, especially what we are calling as root cavities. So those are the cavities on the root surfaces of the teeth. So the remedies would be those fluoride supplements, like the fluoride varnish, good consistent routine with a caregiver every night, every morning even. And biotin is an option as well to replace the saliva and coat the tissues for comfort. And then sometimes a humidifier also helps if the mouth is dry and you're mouth breathing a lot. So let's see. We also talked about suction units that we could, purchase. So if drooling is a problem, then a suction unit would be helpful for just doing the cleaning properly, so that patient isn't drooling all the time, and we can clear some of that debris. Okay, and the next question is, how does reduced ability to swallow in Parkinson's affect health? So I think that was already answered, but yes, it leads to food residue in the mouth and or cleansing of the mouth, and increased risk of decay and gum disease, and possibly aspiration of oral bacteria into the lungs. Okay, how do clenching, grinding, or jaw tremors in Parkinson's affect teeth, and what remedies are available? So yes, you've got grinding and clenching. is a very common problem, and they can cause fractures of the teeth and a lot of joint issues and muscle pain. And the remedies, normally we would recommend something like a night guard. But of course, we talked about caution with those because it's probably not ideal for patients with jaw tremors or swallowing issues. So that would need to be specifically evaluated with the patient, given the patient's medical conditions. And then Botox also, we talked about that, but needs to be also consulted with a medical doctor to see if something like that would be helpful. Sometimes like just wearing a night guard during the day can also help if it's just daytime clenching, and if it's supervised, that may be an option. So let's see, the next question is, how does neck dystonia or limited ability to open the mouth or tongue movement in Parkinson's affect oral care? So we talked about, the neck being at a different position will affect care for just coming into the dental office. And usually like we use pillows, adjustable chairs, and those foam bite blocks as well to help open up the mouth so we can see. And then just shorter appointments also is helpful for any kind of jaw fatigue. And then let's see. Yes, we also talked about the limited tongue movement and that it leads to fungal infections sometimes and bad breath and decay. So a routine, consistent brushing every day, inner dental brushes, suction devices, those are all really good for at least clearing some of the plaque off of the teeth. Usually that the tongue would do, but a lot of times it's a weaker tongue, so it will not clear all that food that just builds up there. So number 6. Okay, next question. Do dentists prescribe any exercises to Parkinson's patients to help with the dental health beyond brushing and flossing? I would say normally we don't do that ourselves, but I have referred to specialists, to possibly like a physical therapist or an oral medicine specialist or even a speech therapist to help stretch the mouth to help increase opening. And then also occupational therapists or speech therapists may be able to help with exercises for swallowing and strengthening those muscles. Okay, so the next question, what suggestions or tools can help someone with Parkinson's brush effectively despite movement difficulties? So those alternative toothbrushes, we talked about an electric toothbrush with a large handle, and also using those inner dental brushes or the floss alternatives can help with cleaning the food that gets stuck in between the teeth. Okay, and then again, consistency. I stress consistency, and anything is better than nothing. So even wiping the plaque that builds up with a gauze or like one of those foam swabs is better than nothing. Okay. And then number 8. So does cervical dystonia or other facial muscle dystonia or jaw tremor have an effect on bite? And could it alter bite symmetry and then cause tooth damage? So yes, this is true. It if the jaw is in an unstable position due to jaw tremors, that can affect the bite. So it leads to uneven bite and shifting of the jaw position. So when we restore the mouth with the crown, that makes it more difficult probably to predict how the bite will come together. So we will probably do more conservative treatment instead of long span bridges, things like that. because the bite would be hard to predict. So also tooth fractures are common if there's just one side of the mouth that's being put into contact, and also muscle fatigue can affect, can be a cause of or a result of the jaw being constantly stimulated. So I think that is the end of the list there.
Excellent. Thank you. Those are a lot of great answers. So we do have a couple of questions in the chat if you still have time.
If you want to stop sharing, then we can see you.
Yes.
Perfect. Awesome. Okay, good. So somebody put in the chat, is it worth seeking out a dentist who specializes in treating PD patients? And then the next person said, must be tough to find one. Sounds like we found one, but for those not in our area, of course, that's kind of tricky.
So the first question you said was, is it worth seeking out a dentist who specializes in treating PD patients? I would say it just depends on how much treatment I think is needed. If it's someone who doesn't, it also depends on the stage of the disease. So if it's someone who is relatively early in the disease process, it's possible that a regular dentist can see them. But if it's someone who has trouble staying still for longer than 10 minutes or 20 minutes, it's probably worthwhile to seek out somebody who specializes in, who at least can provide maybe some sort of sedation options. So that would be my answer to that.
Okay, thank you. Do you see the questions? Do you want us to read them out to you? Okay.
So the next one is, with fluoride in the news so much lately, what are your thoughts on treatments? That's a great question. So the fluoride, I would say, is something that is very well researched in the dental community and has been for decades proven to lower cavity risk. So the American Dental Association strongly supports the risk of fluoride, fluoridated water, fluoride treatments for the long term, I would say. So we're actually lobbying, the ADA is lobbying for that to be a long-term solution to address cavities. So I highly recommend fluoride still. Good question. Okay. Your thoughts on tongue scrapers, helpful or dangerous? Tongue scrapers are good. I think a lot of times the tongue gets missed, and even like a toothbrush doesn't properly clean the tongue. So I think if it's tolerable, then I would use a tongue scraper just to get that debris off the tongue. So helpful. Thoughts to deal with geographic tongue. So geographic tongue, for most people, is actually just, I would say, an anatomical variation. It's not really anything to be concerned about, and it's like a birthmark. So unless it's something that's painful, then if it's painful, it needs to probably be referred to an oral surgeon to evaluate what kind of treatment can be done. But in most cases, geographic tongue is asymptomatic. Okay. So why do neurologists tell their PD clients to drink lots of water more than non-PD patients? This might have to do with the fact that we're very high risk for the PD patients are very high risk for forming cavities and are mouth breathers. So from a dental perspective, I would say drinking lots of water is very helpful for washing away the food, and then also cleansing those debris out. And also, you know, if you're a mouth breather, then it can help with gum inflammation. And the dry mouth is from the medications usually. So that is probably what I would think. in terms of drinking lots of water. So let's see the next question. Have you had any experience with tongue biting? I sometimes bite my tongue in exactly the same place when chewing or even talking. It is very painful and sometimes occur for many days. Any thoughts or recommendations? Okay, so it sounds like the way that in this particular case, the teeth are coming together, it may be contributing to the tongue biting. Sometimes if the tongue is big and the arch is narrow, then it will result in tongue biting. As far as thoughts or recommendations, a long-term solution would be probably to get some braces or orthodontics to expand the teeth. That is definitely something hard to deal with. Okay. I see a dentist every 6 months, but have noticed a surge of dark tartar at the base of some teeth. How can I deal with this in between visits? I use a Sonicare and floss daily. This seems to be a new thing for me. Any in between self-care suggestions? Yes. So remember I talked about brushing at the gum line. So this, if it's at the base of the tooth, it's right at the gum line. So you want to, once that tartar forms, it's calcified, so you cannot get it off with a normal toothbrush. So you want to get it off in a soft state. So a water pick can be helpful if that's something that you can use for getting that gum line a little bit better. But yeah, once it solidifies into tartar, then you have to go to a dentist to remove that. So I would say try a water pick or try brushing more on the gum line. Okay, I started using Stella Life rinse for a condition on the inside of my cheeks, which makes my mouth dry. Is that the same thing as Biotine? I think it's similar. I'm not 100% sure, but I'll have to research that on my own and get back to you. Biotine is a salivary substitute, but Stella Life rinse may just be like an antibacterial rinse, but I'll have to double check that and get back to you on that. Okay, so what if you get food stuck in your tonsils? Is that a dental or medical issue? Also, my dentist tested my saliva at my last dental appointment and tested the bacteria along with a video on correlations with dementia and dental health. Could you comment on that? Okay, so first question, it's very common actually to get food stuck in your tonsils if you have big tonsils, and a lot of times tonsil stones will come out as well. Some people don't get them, but they dislodge sometimes, and they're these little basically balls of bacteria, which sounds gross, but it happens to a lot of people. So it has to do with the food, yeah, the anatomy of your tonsil. So I would recommend just gargling with salt water. Sometimes that can dislodge the food or the tonsil stones. And if it's a tonsil issue, I would probably, you know, if you're having something like sleep apnea or you wake up a lot in the middle of the night, that's more of a medical issue. So if you ask your primary care doctor to look into your mouth and see if your tonsils are preventing you from breathing properly, then that is something that would be a medical issue. So let's see. Also, my dentist tested my saliva at my last dental appointment to see the bacteria along with a video on correlations with dementia and dental health. Could you comment on that? Well, that's really cool. Sounds like they are testing the pH of your saliva to see how cavity prone you are. So that sounds, I don't know about the correlations with dementia and dental health, but sometimes testing the pH will actually, you can put your saliva into and use like a pH test strip, and it will tell you how acidic your saliva is, and that can directly relate to how cavity prone you are. So it's just a tool that we use to determine cavity risk. Okay, let's see.
I have a question. I have two questions actually, based on your slideshow. Thank you so much for all the information. But you had mentioned about carbs being left on the teeth and that leading to tooth decay. can you do anything like rinse with water if you don't have the ability to have anything else? Does that help?
That's really helpful. Just rinsing with water can wash away any of the carbs. And then if you don't have a toothbrush or anything, or even using those like picks to get the food in between your teeth, that can clear the big pieces so that at the end of the day, it's not sitting there the whole day. So yes, rinsing with water, lots of water is good. And then I would suggest if you can, like those dental picks, carry them around with you in your pocket and keep them in my car. I get a lot of food stuck in my teeth too, so.
Right. Another thing you talked about was those root cavities, those ones right at the like at the gum line and the tooth. And so you mentioned the two different types of treatments. What about those treatments versus just getting a regular filling?
Yeah, that's a great question. So we sometimes use a combination of both. So the silver diamine fluoride is, I would say, in the last 5 to 10 years has been gaining a lot of traction because it's easy to apply and it actually arrests the cavity, unlike fluoride varnish, which is more of a preventive measure, I would say. So the solution itself does not fill the hole. So if there is a cavity, then if we place that solution, then the food will still be getting caught in that hole. So that's why we say it's more of a temporary solution, or it needs to keep being reapplied, because if the food keeps getting caught there, then the cavity will continue to progress. So a filling is in combination with a silver diamine fluoride can be helpful, but sometimes a filling is not possible for certain populations, and so we'll just apply the silver diamine fluoride preventively. And then if it gets to the point where if say we can't do a filling, but we need to address an infection, then that's when we would go into like sedation options. I don't know if that answered your question.
Yeah, thank you so much.
Howie, you have your hand raised. Do you have a question?
Yeah, I got a question. I have a suggestion. I use this electric flossing thing called Floss, Flaus. It's really good. I recommend it. You would just replace the tip, the end there.
Oh wow, is that it?
Yeah,
That looks great.
yeah, it's really good.
Flaus.
Has different speeds because my hand, I don't have much dexterity in my right hand, and it really helps get the back teeth. And
That is a great recommendation. Thank you for sharing that.
sure.
Where did you get it from?
Oh.
Do you remember?
Oh, he's
I
muted.
muted him,
Oh,
sorry.
sorry. Howie, unmute, please. Thank you.
Okay.
Oh, he's coming.
There's another.
Okay. Yeah, I got it from Shark Tank. I ordered directly, I think, from the company. It might be floss.com, FLAUS.com, or Google it.
Yeah, that's a great tool. Looks like, so you just replace the end, right?
Yeah, that's right, the tips, yeah.
That's
And
perfect. Yes.
mail is about $75. The tips come in the mail every 3 months. I get a package, and it really helps me.
I would highly recommend that as well.
Very cool.
Thank you.
Sure.
Okay, brush first or Sonicare first? Okay, so you mean floss first? I'm not sure. Maybe it was floss first or Sonicare first. So I would say as long as you're doing both, either way. But if I were to think about it, I would probably floss first to loosen up the plaque and then brush away the plaque. Okay. Is it necessary to replace a decayed tooth? Or yes, it just depends on where the tooth is. So say the decayed tooth is something that needs to be removed, like an extraction. Then if it's in the front, and it's an aesthetic concern, then yes, we can replace it usually with, there's different options, but one of them is removable, like a denture, and then another one would be like a bridge or implant, so those are fixed. If it's a back tooth and it's not really functional or you don't need it to chew, then it may not be necessary to replace.
We really appreciate you answering all of our questions. Your slideshow was impeccable. If you don't know, Lisa and I and Mo, we are PD Connect. We teach exercise and education for people with Parkinson's, and you can check us out and exercise with us 6 days a week at pd-connect.org. Thank you so much, Dr. Christina Woo, for joining us today and answering all of our questions. That was delightful.
Yep, Dr.
And
Christina
very
Woo is
informative.
with Itani Dental in San Francisco.
Yep.
So we will have this recorded and all the information will be in the newsletter. So again, thank you so much, everyone. This is our first Monday of the month speaker series, and be sure to sign up for the next one.
That's right. Awesome. Thank you so much, everybody. Have a lovely afternoon or evening, wherever you are.
Thank you for having me.
Bye.
Bye.